So today I'm extremely happy that we can welcome here Antonín Hlavinka. I consider him as one of the biggest experts for artificial intelligence in the Czech Republic. I would love to ask you to introduce you to our audience. So if you can a little bit say a few words about yourself and about your passion and artificial intelligence.
Yeah, hello everybody. I'm Director Deputy of the fourth biggest hospital in Czech Republic. It's University Hospital Olomouc. And now I'm at the position Director Deputy for Innovation and Digitalization. Previously, I worked as IT Deputy, but we have to decide, or we decided to split this function because of new innovations, because of new stuff, medical stuff, AI in hospitals. It's a very hot topic theme. So we split this function, and now I'm responsible for the innovations, digitalization in University Hospital, and also the director of the department in medical faculty in University Palacký in Olomouc. And I'm leading the course for future doctors or the medical students, which is mandatory for them. And we are teaching them some stuff about AI, about mHealth, eHealth, cybersecurity, assistive technology, and interoperability as well, and so on. So it's also my part of the field.
So I think this subject is totally new for the healthcare professionals. So how they are taking it? Do they understand? Do they see also the vision as we see the vision also in the future in AI?
Yes, some of them, yes, because it's fourth grade, which is I think the hardest grade for that students, and sometimes they are accepting it very smoothly. And some, maybe the half of them are, very reserved about the new stuff because it's not their topic so far. It's they find out it's very interesting for them, but they have not such a time for get deeply in this topic.
And what is the situation with the more senior professionals, for example, in your hospitals? How they accept this new technology?
It's changing. I think the COVID was a game changer because I'm divided the time before COVID and after COVID. In case of accepting the new technologies. Because we are also the National Telemedicine Center in University Hospital. We are a competent center of Ministry of Health for the telemedicine and adoption of mHealth generally. And there is big difference between that time. So before COVID, they were very reserved, the patients as well as the physicians. And now after COVID, they started to ask, and we were not able, to fulfill their needs. So now it's, I think, in the right way, in the right track, because they are now accepting, they are able to work with the new technologies, especially with AI. I think half of the physicians are using personally the AI, the ChatGPT, the LLM models generally, because it's helping them, and now they know that it's, for example, in decision support and some kind of stuff, it's better than the best physician in that particular field. So I think that now it's changing, and also the most conservative doctors, the oldest one, are slowly accepting this new technology, especially in radiology, because there's certified AI, and it is very acceptable for them to use it because it's saving time.
Yes, yeah. They are more open.
Not all, but I think the more than half of these physicians are able to use it and not afraid of using this technology.
It is very well known that AI was coming into the healthcare sector, especially in the hospitals, in the radiology field. So because the AI can analyze the CT, MRI scan, X-ray, or mammography reports, and they are very smart, and they can spot very early, much earlier than a physician. So it is very well known. But now the AI in a hospital is not just radiology, and very few people know about it. Can you explain and give us a few examples that where you can use the AI in a hospital?
Yes, we have to divide it on, for example, the administrative part of the GPT or AI generally. and the clinical using. And the clinical, we have to divide it to the certified one and the uncertified, the experimental one.
Yes.
So we are the research company as well, or research organization. So we are developing our own models. We are trying to train the new models, but they are not certified device or software
not
or
yet.
models. Not yet. Maybe, generally the general LLM models won't never be the certified solution, because you have to prove it. What is the data set you train the model, and you are not able to prove the general model. So that's why it's very hard to certify this one. Maybe it won't be able at all. I don't know. But if you're using some local models, some special models, the narrow AI, it calls narrow AI, and you can train your own model and you can start the certified process. So you can, count with the future certification, and you can start the developing of this model and the clinical trials, etc., according the certification standards and needs. So it could be done, but it's a long run. It's for 3 to 5 years, from start to end of the certification process. And also it depends the usage of these models, because you can use it as a class 1, for example. It's quite easy. And if it's some kind of decision support system for clinicians, they are able to count with this as a supportive tool. You have to certify it as 2B or 2A. According to MDR directions, and it's very complicated, it's very hard and very expensive as well. So, and once you finish the certification, your model is obsolete, it's out of date. So,
so you have this kind of models or like devices, softwares, whatever, in a process, and then you have already certified probably from suppliers.
Yes. We are using this or certified, which is mostly the part of some modalities, for example, the CT and etc. It's part of this equipment. Some of them are, for example, the Czech startups like Carebot and others. They are already certified, but they are software as a service. So we are consuming it as a service, and it's already certified, and our PAC system are also certified, so it's compatible, and we can use it quite without any scare or something.
And can you count, or can you share with us how many tools with AI right now is used in your hospital?
I think it's more than 10. More than 10 tools, because for administrative tool we are using the Copilot from Microsoft. I don't know if I can tell
Sure.
Yeah, okay, it's no problem. So Copilot, we also have some license from OpenAI to the latest GPT models, because of the best results of clinician works. So we have the agreement. These data are stored in a European Union servers infrastructure, and there's some guarantee that they won't train the new models from our data. So it's very mandatory for us, because we are also under the cybersecurity law, GDPR in European Union, etc. So that's one part. It's the administrative tool. Also, we tried some special tools for legislation, for agreement, validation, etc. So it's some special tool for that case. And for marketing, it's some picture and video generators, etc. So that's the administrative tool. It's quite normal now in a university hospital. And the clinical part, they are as I told you before, it's some MDR certified clinical models for radiology, for the CT scans, etc. And we tested 3 of them and compared between each other, which is better specificity and so on. So now we are about to call the public tender for the provider of that tool in general in all these fields.
So you are not only focused on a Czech providers, but you are like open to any global one. Who is the best tool actually for your services?
Definitely. Because as I told you that some kind of this MDR the AI tools professional are part of these modalities. So we are trying also to use these modalities for special cases. For example, colonoscopy, they are analyzing from videos, etc. So this is another part of using of AI in hospital. And we also started lots of projects in history. For example, during COVID, we started the first AI tool which identifies the cough of the ill people, the distance between the peoples, and it was some automatic system, cameras and microphones in a big department, and they were monitoring all the peoples and the security, just checking the monitor and counting the incidents. So it was the first usage of the AI models in hospital. And then we started some kind of multimodal agentic projects. For example, in post-COVID syndrome, we combined, it was some grant from Czech agency, technical agency, and we started a project which should identify or predict the severity of post-COVID syndrome. So we combine all the data, laboratory results, CTs or X-rays, and combine it with the EHR reports and try to predict, the development of this illness. It was quite good because we get precision above 80% of the recommendation whether the patient is ready for the right treatment. So it was I think second big AI project. And now we are starting the new big project, which is legalization of telemedicine in Czech Republic. It's from structured funds from EU. And this project is not generally focused on AI, but the secondary effect or secondary projects are using the AI in a telemedicine. So, for example, if I'm collecting the telemetric data from patients, I can use, for example, scan ECG or something like that via the AI, which is implemented in this telemedicine platform. So it's we will start, or we're piloting about 11 or 12 interventions, telemedicine interventions, and the goal is to get the codes for insurance companies. So that's the goal of this, and also the anchor is it in a Czech legislation. Part of it it's already done, and now we are continuing. So this is another part of AI which are start to use, and now we are finished lots of projects, the Horizon projects, which is a big project from European Union, and now there are calls from about the AI, general AI in medicine, etc. And now we are applying, for example, 1, 2, 3, 4 such projects. So one is for devices, one is for multimodal agentic system for IBD patients. One is for some special HAPAX method using in medical system or medicine. It's like some patented tool from University Palacky, and we are now testing it through some project. We are about to testing it. If the project will be success in some special cases of training the staff, for example, predict some kind of neurological or neurodegenerative illness, etc. And the last is some kind of microbiology system which could predict ahead with the infections, for example, bacteria infections in some department, and we can shorten the time to identify the right bacteria from 1 week to one day, for example.
You are actually the leaders, I guess, in Czech Republic, because you are really the hospital and institution using the most AI in Czech Republic. Who is actually the person who is deciding which project is going to be implemented?
Yeah. It's a new committee we established last year. Last year we started this project. We established innovation committee in our hospital, which are part of the clinical professionals. There are lawyers, there are a DPO, IT guys, our innovation guys or from innovations, and for example, the biomedical engineers in some particular field. And we have some systems. So if someone would like to test or adapt or buy or something, some AI tool, so he can apply for this project, internal project, and we will decide whether the project is viable or not. And if everything is okay, the money, the project, the goals, the KPIs, the cybersecurity, etc. So we can validate it, or we can provide it to the deputies and directors.
Okay.
Yeah.
You mentioned correctly those many things that the companies or you needs to comply about, like the GDPR, cybersecurity, and so on, especially cybersecurity. Last week I joined the AI big conference for cybersecurity for the hospitals. There was a big discussion about the new regulation. Actually, you need a lot of new position people. Do you have those teams? Do you have those experts? Or you had to totally change the resources? Or you use your old one and retrained?
Yes,
Okay.
but mostly because, as I said, we have or we had to the quite big team from National eHealth or Health Center. So we are very close to AI projects as well. So we are now using that guys for the projects, for the validations, and for the seeking of new opportunities, for example. We are in tight connect with the clinicians, because they are now coming, on their own, and then they would like to ask us whether they want to buy this one or test it and piloting. So that's the committee which decide whether this project is viable and whether we are start the POC, for example. So it's very mandatory, the POC testing before public tender or something like that. So we are piloting in whether the results are okay, satisfied. We are satisfied. Everything is okay. So now we, already know what we want. So we can start public procurement. It's a very hard stuff to create this and to go through this public procurement, because it's quite tricky.
And you have now a lot of projects ongoing and also finishing and coming. Who has the capacity actually where you would like to end up? Because this is never-ending story.
Yes.
So what is the aim of the special committee, innovation committee, or your hospital?
Yeah. I think the goal for University Hospital generally is, to create the treatment more effective. Costless and more effective. I think this is the goal for everyone. So we are the testbed piloting, and the end we should try or create some kind of spin-off or startup, or joint with a university, create startups, and for example try to get the certification for clinical usage, for example, in this special case. So this is the goal, and we are on the road, I think in the right direction, and it's really hard stuff, because we are lack of this public notification bodies in Czech Republic, so there's lack of the professionals for the certification process. Yes. So it's a very limitation for everyone, I think, in Czech Republic.
And how you can, or do you measure the impacts already, the financial impact, social and medical impact?
KPI. Every project should establish and start the KPIs. For example, the time shortage, the cost effectiveness, as you mentioned, the specificity, and global overall effectiveness of this new model or new AI or new tool, whatever it is. It is not only about AI. It's about mHealth applications. For example, we have some special mobile application which can automatically detect whether the wound, for example, is healing properly or not. We can use this mobile application for electronization or digitalization, the paper health records, etc. So it's very, very broad field of usage innovations in hospital.
And what was your biggest surprise when you get the project and you get the results, that you were really surprised that, I never think about it, that we could save so much time, we could save so much money?
I think it's nothing yet is such a big deal. Such a big deal. I think generally the LLM models are very big game changer.
Yes.
But it is not only in a clinical field, it's also in an administrative field, but lots of guys using the LLM, the secure LLM models, they are well-trained professionals. And for example, I can get one example. The normal method, for example, was some ill patient, and we were not able, the clinicians and the biochemists were not able to use the right diagnosis for 2 months.
To identify it.
It was very hard, it's very time spending, and I think annoying for the patient. And after that field, we decided what probably the diagnosis is the right, and we tested. We put it in a new GPT model for 03, and it was in 20 seconds right in the first place, the right diagnosis. So it was wow, game changer. So we decided to buy lots of license.
It was a very good example. So yes. I was wondering that you have this kind of example.
And another one was when we tested the CareBot. It was special. I think it was CareBot in radiology, and was some case with a broken arm or something, the patient, and the AI recognized the small mark, and it was the tumor, and so we saved the patient in very early stage. So it was life saving, definitely. So that was two big examples which shows the AI is really game changer in healthcare.
If you can a little bit move to your person, when and where the passion for artificial intelligence or telemedicine actually became?
Yeah, I'm an IT guy from many years, for many years now, about 35 years. I'm a professional in IT. And first, I met the AI. It was pseudo AI. It was some machine learning in a university, in school, 24 years ago or something like that. And now there was, calm, nothing more than some special, very nerd tools, AI, and it was really calm. And now, before 4 years, it started. Maybe 10 years back, it started the radiology systems, yes. But there was not certified, definitely. And then we started testing the special narrow AI for special uses, as I said, the COVID. It was before the LLM times, and after the GPT-3 or something appears. So it's starting. It was amazing. It was something like I dream of about 10 years. Such a tool would be very perfect. It must be done somehow. And 10 years later, it's here. It's really game changing. And if you are not able to follow the changes. It's every 14 days is something new. You have to test it, because if you start now to test some model or something, some technical specialty, you are start testing it. You are wasting lots of time, and after 2 months, it's already done, and it's a part of this general model. So it's really, really hard for every scientist and etc. to create something new, because it's so quick, this development. For example, now the Microsoft, I think Microsoft has the new model, and it is 4 times better than the best clinicians for decision support or from differential diagnosis. Yes. It's really game changing. And it's also save costs for the treatments. It's tremendous. We contacted Microsoft. We would like to be part of this research team. We have to test it. It is amazing. So we are in the list.
And do you think that is just the beginning? And
this is the beginning. For example, imagine if now you know that the precision of the model for radiology, for example, is 95%, and the precision of the best radiologist is 75%. For me, it's simple, and the radiologists cost 500 euros, and AI costs 50 euros, for example. So I think the decision is
simple.
quite simple.
Okay, you have these comments here. If you would go to your doctors in your hospital, you would tell them how they will react.
I'm using the AI, for example. Every medical report, I just try to analyze with the GPT, with the AI, because I understand it, and I can go to my clinician or to the professional, and they know me. So it's quite easy. They expected that I will challenge them with the AI. So once they see, for example, the results, they are amazed. They are, it is still, it's something new for them. How precise it could be, how time-saving it could be. So it's we are not able to satisfy all these ideas from these doctors, because they are playing with this. And now they got the idea. We can set it, for example, the application in the ambulance. It's a QR code on a field, and the patient, which is waiting for the treatment, he can scan the QR. It's open the symptom checker, for example, which is AI-based, and now they can check, or it's asked for every symptom, every problems that the patient has. And the end of the process is the structure report for the physician. The physician see it, and you just can ask for some special cases. So it's very productive. It can save lots of time for with the patient, and the patient is satisfied, because during the waiting, because the waiting times in university hospitals are quite big, so he can very proactive use this wasting of time by productive things.
You mentioned now, and you gave us several examples of very successful stories and your devices tools. Is there any failure?
Failure? I think failure is, yes, to start the POC and start the procurement. I think the right set of this public procurement, set the price for the procurement, and all this needs the properties of this. It's very, very hard, and sometimes it could happen that you are not able to get it, because someone just stop it because it's more expensive, or it's less expensive, and it's focus on only one field. I can do this field, so they can
there's a conflicts
of interest, and we are the poor guys which facing this thing. So yeah, this is very bad in public.
Also, when we saw each other last time, you mentioned that your kids are educated and use AI home regularly. So they still love it? You still love it to do it with them?
Yeah? Yesterday I just learned mathematics with my daughter, and she was using for 2 hours the GPT to create the geometry, for example, and it creates the examples and the results, and it was quite sophisticated, and it's very cool for GPT. You can ask, if you are not able to understand this explanation, for example, the mathematical records or something like that, you can ask, explain to me like I'm a child, for example, and now it's totally different, and I can understand it. Even me, I can understand it, and I can explain it to my daughter. So yeah, it's very productive. I think it's generally in education is maybe big game changer than in a clinics, because the personalized education system or education plans are amazing.
Yeah, but I think it's very important. I have also small kids struggling with algebra and all this stuff.
Yes.
But is it important to use it just as a support and not instead of thinking? Because it's very important that for these kids, they have to use the brain as we did in our time. Because there are some studies from MIT, for example, that people are using ChatGPT, their cognitive function is declining very quickly, because they then don't try it hard. They just quickly go into ChatGPT, and ChatGPT answer everything, and they copy-paste.
Yes, that's right. But I think it depends, because I think the neuroplasticity of our brains are very big. And when the internet, for example, starts, it was the similar things. For example, when the GPS, the navigation started, it was we lost, the control. But we are still here, and we are more productive and more productive. So I think whether is the using is really like, for example, to be more productive, you still need to think, because you have to have some goal. Yes. If you don't have goal, the GPT or LLM just tell you that should be the right goal, but it is not the right goal because it's very supportive. It's the GPT is only machine, is statistics, it's nothing more. And if you don't need whether the goal where the goal is, you are in a bad way, and you are find out sooner or later. You are gonna find out, and now so you have to start to creativity. I think it could support the creativity, yes, because you are not wasting time with the boring administrative tools, with the researching, etc. And you are directly in the center. And it's time consuming. It's very good for your dopamines because you are directly and very quickly to your goal. And it's I think it's everything in history, like atomic bomb or the fire, you can use it for help or you can use it for distraction. It depends on you.
One technical question, just you use a lot of different tools in your hospital, but there is a general global issue of shortage of human resources, shortage of doctors, and in Europe mainly shortage of nurses. Do you see that AI could help this shortage using just patient journey management? So how you manage the patient, shortening timelines, improving the health, but also these HR factors. Is it possible that you can even not solve it, just improve this?
It's possible. It's a very sensitive question, especially in public sector, because when you start the AI, for example, in administrative, in accountant, for example, the employees are starting to afraid to lose their job. So they are fighting against it. It's normal. It's normal. It's the same like some physicians are not accepting it because they are afraid, because they know, or maybe somehow they feel it that could be better than them, and they could be
jeopardizing their job.
Yeah, definitely. That's right. I think it's already happening. Yes. If you heard in Albania, there is a first ministry of I don't know if it's a Ministry of Laws or something in this first AI model. So it's now they fire the ministries and set up the AI agent. I think it's not wise, but I think it's the trend, and we have to come with this. For example, the teachers. I think now if you have some average or under average teacher, it's way more better to use GPT for teaching. It's proved already. For example, in India, there are some special cases that the effectiveness of this education with the AI, with the personalized education, is about 40% better. So you can start the projects, or you can start a training program which are personalized for your level of
knowledge and capacity. And
definitely, and it's very productive. Some I don't know. I've read something about that. 1 year, the university with the GPT could be the same like 5 years in university without GPT. About the productivity, knowledge, and the results. So I think it's a trend, and it's already here.
If you would compare the situation now in the Czech Republic versus the other countries, is it still Denmark who is playing the number one in Europe? How would you consider like a global situation right now?
Yeah, I think it's about the environment. I think that Denmark is nothing better, for example, of using this tool, but there is environment which is very friendly, which is very supportive for developing this AI models, for adapting it, for using it in a clinical practice, for example, etc. It's very important. In Czech Republic, it's very lack of this supportive ecosystem for innovations in generally, not only in healthcare, but generally it's a very lack of supportive laws, initiatives, etc. It's getting better, but I think in comparison with other countries, it's very bad. Not only in AI, but I can see it in e-health, in mHealth, using of telemedicine, for example. We are in the if you can download the DESIS index, within the European Union, and if you filter the healthcare or digitalization, so we are, I think, last second or something like that, the Czech Republic. So we have to long way to get it. And for example, in the US, they have no obstacles like the
GDPR.
Not only GDPR, AI Act, and cybersecurity law. I think it's not good, and that because they have not everything under control, and it could be a problem in the future. But I think now for the productivity, for the innovations, and yes, it's very good. So a lot of countries are ahead of us, but I think it's getting better, and now the whole European Union just realized that we have to be competitive and we have to start to support this innovative ecosystem. So we just established the Digi2 Health, which is some hub, digital innovation hub in Olomouc, and there is the government, local government, University Hospital, and Palacký University, which is the tripod. And we are trying to support the digital medicine projects, system, medical devices, and whatever. So testbed, piloting, support the granting, fundings, and creating or support the startups, etc. So yeah, we are first in Czech Republic in that field in digital healthcare. It's very hard to get funding because we are not, for example, only focused on cybersecurity or AI or the high computer performance. So we are in the middle, and it's quite hard because the system is obsolete. It's not, so supportive for new innovations, for example, in healthcare, which is very important for me.
And finally, how you see your hospitals in the next 5-10 years in case of the AI tools and services, and yourself within this system?
I think that we could start some AI department, the only AI department. I just read about it. I would like to get to see it in China. They just created some kind of hospital, but it's very confidential. So we are not able to get there. But I think this is the future. The AI robots or AI tools, AI agentic systems, which are with the supervising of the medical stuff, but still I think it's a future. Yes. The 100% agentic or AI hospital. I think this is the future. In 5 years could be the first models or first examples. And me in 5 years, I'm not sure. Maybe I will have some implanted in my brain to be able to understand the AGI, for example. I don't know.
I have this question because you mentioned this special hospital in China with only AI and robots. Do you think that the patient would actually love it? Because they're coming to hospital just because of the doctors, to have a personal contact with someone human. So do you think it could be accepted? I mean, of course, we who love the AI.
Depends on generation, I think. Our generation, we are used to the physical contact and face-to-face with the doctor. It's some kind of satisfying. It's our brain is just learned how to behave like that. But the Gen Z and Gen Alpha, I think they are completely different. They are afraid of physical contact.
And they're display dependent.
Yes. So I think for them, it is the future, and they will create a future for themselves. I think that's the way, and we were on the back, and we will just check it and maybe afraid of it and etc. So I think that's the future, and we are not able to stop it. It's already here. I think the Rubicon has been crossed, and now we will see.
And as we are in connection with so many startups, new companies developing something with AI, if they would be interesting to test it in your hospital, so what would be the best approach? To contact your committee? Yeah,
we have some form, the innovations our hospital CZ, fnol.cz, and you can download the documents, for example, the examples of agreements, and you can write down your idea and the part of the cooperation. And we can get it, we can read it, and we can decide it whether it's okay for us or not, and we can contact it and create some piloting, get some fundings, for example, free capacity of the clinicians, data from IT guys, data governance, cybersecurity, everything must be done. Maybe clinical trials, so we have to create also the clinical trials, whether it's some mandatory field. And that's it. So it's quite simple, but
but in general, you are open for such collaborations.
But generally, we are very open. We are, as I said, we have the Digital Innovation Hub, which is the front door, for example, for these new innovation startups, and also the big companies, because we are looking also for the big companies which should support this Digital Innovation Hub, and it could support the young, brains with ideas and new startups in that field. So yeah, it's very, very likable.
It's interesting, extremely interesting.
Thank you so much. It is very promising, and congratulations for this nice achievement that you get in this last few years.
And hopefully in a half a year we'll be able to speak about some new projects and the development, as everything is going so fast. So we'll be very happy again to welcome you in a few months.
Yeah, thank you very much. I think there will be lots of projects done, maybe lots of projects started. Yeah. So I'm looking forward, definitely.
Thank you.
Thank you very much.
Thank you so much.